Imagine a job where in the blink of an eye you transition from comforting a patient to managing a life or death crisis. That's the reality of nursing. It's not just about showing up and performing tasks, it's about navigating between calm moments and bursts of chaos, constantly shifting between being a healer and a crisis manager. One minute you are at the bedside offering reassurance, the next alarms are blaring and the whole atmosphere changes. Sounds stressful? Well, that's only part of the picture. Let's talk about what is it really like to be a nurse. Nursing isn't a single-paced predictable job. The moment of calm, those rare times when you can breathe and reflect, are sometimes interrupted by kind of an intense situation that demands quick thinking, fast action, and sometimes emotionally tough decisions. And that's what we train for. But even in those chaotic moments, there's a rhythm, a flow that you learn to recognize. You get into it not because you're a hero, but because that's the job. Take the mornings at my ward, for instance. The day usually starts with a calm atmosphere that almost feels deceptive. You clock in, grab your assignment sheet, and make your first round of checks. It's a time to gather information, to get a feel for how your patients are doing, and to ease into the day. But you never really settle because at any moment things can escalate. I remember one morning that started just like this. A calm shift, nothing unusual, just routine checks. I had a patient recovering from surgery, stable but still in that delicate post-op phase. She'd smile at me during my early check, and I remember thinking, today might be quiet. Don't ever think that. And if you think that, don't ever say that. Because the thought had barely crossed my mind when suddenly I heard the telltale beeping of her heart monitor. And things changed fast. Her blood pressure had plummeted. In that moment, the quiet was over and the adrenaline kicked in. That's what nursing is about. Being prepared for the unprepared. And this is the essence of nursing. It's about being prepared for the unexpected. I've often found that these moments of calm can be deceptively powerful. There was this elderly patient of mine admitted with pneumonia. He was stable but fragile. I remember sitting by his bed one afternoon after administering his meds and checking his vitals. He wasn't saying much, just quietly looking at me. I was ready to move on to my next patient when suddenly he asked, "Do you think I'll make it?" It wasn't a question I've ever expected from this patient. And for a second I was caught off guard, but instead of rushing to the next task, I stayed, I talked to him about his concerns, reassured him about the treatment, and more importantly, I listened. That conversation lasted maybe 5 minutes, but to him it meant everything. In those moments, I realized that nursing is as much about the small personal connections as it is about clinical care. As the day progresses, I'll get into the rhythm. Some shifts feels almost serene. I perform checks, administer medication, answer call lights, and juggling my paperwork, all in relative calm. But even then, that sense of a balance is fragile. One patient deteriorating or one unexpected event can shift an entire day from peaceful to frantic. But here's the thing, not every day is about life or death decisions. Many days it's about the little things, the routines, the task that keeps everything moving. It's about the satisfaction of getting through a shift where you help people in ways big and small, even if no one else sees it. It's the pride in knowing that you made a difference, whether it was stabilizing a critical patient or simply making someone's day a little more bearable. And at the end of the day, the balance between action and calm in nursing isn't always a 50-50 split. Some shifts are pure chaos, others feel peaceful. but it's always there, that tension between the two. It's about knowing how to navigate both, how to respond when things go sideways, and how to find those moments of calm, even when you don't seem to be able to find them. That's the real skill in nursing, and I'll have an upcoming video about finding quiet moments. I also have someone where I talk about it on my channel, so make sure you subscribe and click that bell notification icon, and let's move on. And if you ask me what keeps us nurses coming back day after day, it's not just the adrenaline or the quiet moment, it's the balance between them. It's the knowledge that even in the toughest shifts, there's always that rhythm, that flow that brings everything back to center. Nursing is like walking a tightrope with action on one side and calm on the other. But if you find your footing, you'll learn to walk the line. You will not learn to walk it perfectly, but with enough grace to keep moving forward and looking eloquently. And that's the essence of a day in the life of a nurse. Action and calm, always in motion, always shifting. You may start in one place and end up somewhere entirely different. But in between, there's a rhythm that keeps you going. The balance is delicate, but that's where the heart of nursing lies, somewhere between calm and chaos. And if you want to get smarter on how to relate to your patient, check out my playlist on Michael Bakhtin right over there. I'll be seeing you over there in that playlist. So click it, and I'll be seeing you there.